Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. How you wanna be? Show me how it will be. How you wanna be? Show me how it will be. Listen to the show, the more you'll know about your health.
And welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the show. We've been away for a while, and today we have a wonderful show for you. As you know, the whole healthcare system is changing. We have a new healthcare plan that's about to start, and there's a lot of confusion with the new healthcare plan. And did you even understand the old healthcare plan? It was confusing as well. I want you to understand today a series of shows that we're going to do called the Continuum of Care. The Continuum of Care. How does healthcare go? And we have a wonderful panel that will be with us today and over the next several weeks to talk to you about the Continuum of Care. We'll be talking about such things as care before you even see a doctor, then the care that occurs when you go to a doctor's office, emergency room, hospital, and then what happens to you after you get out of the hospital, skilled nursing and home care. Joining us is a wonderful panel. Sitting to my far left, we have none other than Miss Glenda Santos. And Miss Glenda Santos is the Regional Marketing Director for the TECIC Group. And that is a group of facilities, nursing and rehab facilities. Sitting next to her is Miss Cora Pruitt. And Miss Cora Pruitt is the Director of Marketing and Admissions for the Hayward Convalescent Facility, where they also have a dementia unit. And sitting next to her is none other than Miss Melanie Cox. And Miss Melanie Cox is the Director of Sales and Marketing for the Willow Tree Nursing Facility and Rehab. And so welcome, ladies. We're so glad that you would be here. We will be joined later by Mr. Harold Goodman, who is the Administrator and Director of Operations for Horizon Home Health Care. And we'll talk to you about what happens after you try to deal with your health at home, go to the emergency room, go to the hospital, then maybe come out to a skilled nursing facility, maybe rehabilitation, and then go home. So we're going to turn to talk. We'll be talking about the continuum of care. Now let me tell you how it was when I first started practice. When I first started practice, many patients would come to the doctor and they would say something like, you know, Doc, I want to get a rest and I want to get a multiphasic and I want you to put me in the hospital and let me stay there for a week and do a colon test on me, do a heart test on me, do a chest x-ray on me, help me to stop smoking, do a heart test on me, do some blood work, and do a different test every day. They may have had Medicare, they may have Medi-Cal, or maybe private insurance. Well, the insurance plans don't really allow for that type of a multiphasic exam on a general purpose nowadays, and not for a rest, so to speak. People would get away from home, the stress that they had at home. They don't allow for that. And they have a new team of people within the hospital that direct care. And those are called, and you all know these folks well, the case managers. Case managers, and the case managers are the kings and queens of discharge planning. They work with social workers, and they work with you all to help people figure out what to do. So it used to be that you could go in the hospital, the doctor would send you in there, and then you would go home when the doctor said that you were ready to go home. So now we have a situation where you have these other teams involved, and it can be very confusing. Mm-hmm. And so there's a whole nother process called health advocacy that I want to talk about too, because the families don't understand, why are you sending me home so quickly? I'm not well yet, I'm still sick. So I would like to, first of all, allow each of you to introduce yourself. I would like to just have Ms. Glenda Santos from the TECEC group. Did I pronounce it right?
Yes, it's TECEC Group Nursing and Rehabilitation. We have 12 skilled nursing facilities in different areas. 4 in Hayward. Cora works with me as well. We have 1 in Fremont, 1 in Martinez, 1 in Vacaville, 1 Santa Rosa, Sebastopol, and did I mention Manteca?
No, you didn't mention
Manteca. So we have, we offered 24-hour skilled nursing services and rehabilitation in a friendly environment setting. It's a home-like setting. We try to personalize each care that we can provide to the patient. And we take all insurance as well, even medical.
Okay. And Ms. Cora Pruitt, you are with the Hayward Convalescent facility, where they have a dementia unit, and that's not very common, at least to my experience and understanding. Tell us a little bit about yourself.
First of all, I want to thank you for inviting us here in the Healthbeat. I'm the Admission Marketing Director at Hayward Convalescent, one of the facility of the TECEC Group Nursing and Rehabilitation. We are 99 beds, and we have two separate units. We have a dementia unit, and we have the short-term and long-term care.
Okay, very nice. And sitting next to you is Miss Melanie Cox, the Director of Sales and Marketing for the Willow Tree Nursing and Rehab Facility. Tell us a little bit about yourself.
I'm Melanie. I'm the Marketing Director at Willow Tree Nursing. And Willow Tree is one of 50 buildings in the Covenant Care Corporation. We're a 78-bed facility here in Oakland. And we offer 24-hour skilled nursing care and 6-day-a-week therapy.
All right. Now, I know there's probably a bunch of folks who want to get sick just to go into these facilities. if they have the opportunity to be seen and greeted by such lovely women, what an opportunity. And it's a real pleasure for me to have the opportunity to speak with you all who are experts at home care. And as I said, we'll also be joined by Mr. Harold Goodman from Horizon Home Health Care, who will tell us about what happens when you get out of a skilled nursing facility. Now, I would like to ask you first, Miss Melanie Cox. Here we have a situation. You have a person that gets sick. First of all, they've tried to take care of themselves at home. They try to eat right. They try to keep their sugar right. They try to lose weight. They try to exercise, stop smoking, do the things that would prevent disease from coming on. They come to the doctor. Maybe they do have high blood pressure. They do have congestive heart failure. Maybe as we're getting older nowadays, our older population, they become confused and they fall and they break their hip. Okay, so they go into the hospital now. And because they're 68 years old, they have the insurance for the elderly called Medicare. And I'll ask you all to explain that to me a little bit more. And the orthopedic doctor, who's a bone doctor, fixes their hip. An internal medicine doctor might see them. And now we often don't have the patient's primary, but sometimes what they call a hospitalist. A hospital doctor might come there. So as a result of that, they get their hip fixed, the orthopedists fix their hip, and then they start to go through rehab. They get them up the second day, and they start to walk them, and then what happens after that? What goes on with the patient after they've had their hip surgery and they start walking them, and their family says, I can't take care of Mom, she's too confused, not that confused, and she just broke her hip, and I can't be running over to her house and my house, and I don't think, how can she walk yet? She just broke her hip. From your perspective, what may happen after that?
What may happen is that the case managers get together, speak with the family and the patient, and decide that the patient might need skilled nursing care or acute rehab, but in my situation it would be skilled nursing care. The case managers put all the paperwork into a computer-based system, which is called ESIN, and they send it out to all the skilled nursing in the area where the patient lives. And all of the admissions directors and directors of marketing can go in and evaluate these patients to see if they meet the needs for a skilled nursing facility.
Now, here's a good question. I don't mean to be facetious about this. You said the case managers get together. Does the doctor have any say in it at all?
The doctor,
You know,
of course, has to say so.
A lot of times, it seems to me that it's starting to get like there's a
Hopefully,
real
yes.
question about that sometimes.
Yeah.
There are people who decide these things, and in a situation where you have hospitals, they may tell the doctor, this is what needs to happen with your patient, and we're going to make arrangements for it. And that could be a good thing, and in many situations. Sometimes patients wonder if it's a good thing, because they say, they want to put me away. Is a nursing home, skilled nursing facility, a death sentence? Is it a putting you away? Is it a I'm not going there because you're going to put me away? What do you think about that, Ms. Cora?
Well, yeah, most of the patient and the family, they're scared to put their mom or the patient itself in a nursing home because they think it's their end state of life. So that's our job, to explain to them that it's not. They're going there to have like continuous care, like a therapist, like a physical therapist, occupational, to get back their strength so they can go home really fast.
Now, in this particular model that we chose, we said the patient was demented also, and you have a dementia unit in yours. I know that Melanie Cox at Willow Tree's facility and at the other facilities that Ms. Santos has talked to us about, all of them can do that, but you have a specialty unit. How many beds in that unit that
We have 40 beds.
for
the
people
dementia
with
unit.
dementia?
Yeah.
And does general Medicare, which is the health care for the elderly, take care? Do they pay for dementia care?
We accept Medicare, medical, and private pay in our dementia unit, but it depends. If ever like we admitted from the hospital and their insurance is Medicare, and sometimes they don't have a secondary insurance, that's the problems comes up, because it is hard, because they're gonna pay after 20 days. They're gonna pay
To come out of their pocket.
yeah.
Okay. Ms. Santos, explain to us, so here we have the patient. They broke their hip, they got demented. We've heard from Ms. Melanie Cox that the case managers and maybe the physician should be involved with that process. Says, okay, now you can get out of the hospital. They're too sick to go home. They have dementia. Maybe they're going to go to a skilled nursing facility. The patient and the family say, you're not locking me away for life. And you're saying that this is probably a short-term process till they get rehabilitated and can go home. And then we're talking a little bit about the insurance and how it's paid for. Medicare has actually, I guess, 3 components, A, B, and D.
Yes.
Can you explain to me what's the Medicare A, what's the Medicare B, and what's the Medicare D?
Medicare A covers the skilled stay, the skilled services. Medicare B covers for the medication, all the medication and all the ancillaries. And Medicare D as well. I think it's after certain days of skill, then Medicare D kicks in. For Medicare days, like once they stay in the hospital for 3 consecutive nights, when they go to the skilled nursing facilities, they will be covered for 100 days. The first 20 days will be covered, 100% of the stay will be covered by Medicare. But on the 21st day, there will be a 20% copay. If they have secondary insurance, then the secondary insurance pays for that. But if they don't, then the family has to
So
pay
the
for it.
first when you come out of the hospital, you got to be in the hospital at least 3
8
days
consecutive nights.
behind that hip fracture, and then
It has
you
to be nights. It has to be
nights. Oh, it has to be
Overnights, yeah.
overnight.
Yeah.
Not days.
It's not
It's
days.
nights.
3
Okay, very
overnight
specific.
stay,
So
yeah.
you got to be in the hospital at least 3 nights. Then you can go to a skilled nursing
nursing.
facility, and if you have Medicare and the Medi-Cal, which really is the if you just had Medi-Cal, that's more for people who have low income and sometimes disabled people. But if you had Medicare and Medi-Cal, the Medicare would pay for the first
20 days.
20 days, and they pay 100%?
100%, yeah.
And then what after 20
On the
days?
21st day, there's something like a Medicare, like the profile. How do you call it again? I forgot the
Common
term.
working
Yeah,
file?
the common working file. It will say there how much is their copay on the 21st day. So when they come in, before we admit the patient, we have to look at the common working file, and then we can explain to the family so they know what they have to expect.
So is the copay like,
person
is it like a
varies.
20%? It's
Yeah.
like 20%?
But each person varies. It can be different for me. It could be different for her.
Okay. And then, so from the 21st day, Medicare will pay like 80%.
Yes.
And the 20% will be paid either out of their pocket or their other private insurance
Secondary
or
insurance.
Medi-Cal.
Medi-Cal.
And Medicare will still cover them for 100 days, is that correct? For
It's
100,
justifiable.
Depends.
if it's
Depends.
justifiable.
Yeah, I mean, if the rehab services, let's say the patient needs physical therapy and occupational therapy because of the hip fracture, like in this case, right? But if they are plateauing after 30 days, they cannot do anything anymore. Like the patient cannot, they're in the plateau level, so they need to stop. They need to stop it, right? But
Because Medicare won't pay for it anymore.
yes,
Uh-huh.
I mean,
They can walk 100 feet,
yeah.
more than 100 feet.
There
Yeah.
should be enough reason for them to continue the rehab. So,
Okay.
like, if the family, that's when we discharge them. We talk to the family. We have a conference with them. We have a meeting with them and let them know that this is the status of your mom or your dad right now. We're planning to discharge them home. Or sometimes they want to stay. Sometimes they say, "Oh, we're not ready to take them yet. Can they stay a little longer?" So if they have medical, they can stay. They can stay some more.
They have Medi-Cal.
Yeah, if they have medical.
Okay. All right. We are speaking with a dynamic group from a variety of facilities. Miss Melanie Cox here is from the Willow Tree Nursing and Rehab Facility. We have in the middle Miss Cora Pruitt from the Hayward Convalescent Facility, where they have a dementia unit as well as short-term and long-term care. And we have, you just heard from Miss Glinda Santos, who is the Regional Marketing Director for the Tekek Group, which has how many facilities? 12 facilities. So you're really listening to some experts. And we are now saying that they're about to be discharged, and so we're going to talk with someone who can now take care of Mama at home with some of the same types of skills as we talk about the continuum of care right here on the Healthbeat Show. I'm Dr. Jeffrey Watson. Stay tuned. We got a good one for you. And we're right back here on the Healthbeat Show as we talk about the continuum of care. We have joining us Mr. Harold Goodman. And Mr. Harold Goodman is the administrator and the director of operations for Horizon Home Healthcare Agency. Welcome, Mr. Goodman.
Thank you. It's a pleasure to be here.
We're glad that you're here. We're talking about the continuum of care today, and we have some very astute folks who are here with us. We have Melanie Cox, who works with Willow Tree Nursing Facility and Rehab, and we have Miss Cora Pruitt, who works with Hayward Convalescent. We just heard from Miss Glinda Santos, who's with the Tekek Group, and we talked about the fact that you come from home, then the doctor's office, then you get admitted to the hospital, then you may get admitted to a skilled nursing facility, or you may, from the hospital, still be sick. And as we said from the outset, they can't just put you in there just for a rest anymore, but you may still be sick, but maybe you need skilled nursing, or maybe you're walking pretty good, but you still can't handle it at home by yourself. Where then does a home health care agency come in? What is it that a home health care agency does when a person leaves the hospital or they leave a skilled nursing facility?
Sure. What a home health care company actually does is follow the continuous of the home care that the doctors prescribe, either in the hospital and or a skilled nursing facility. To be more specific, historically, the most recent statistics support that people actually heal better at home than they do in that environment in the hospital. Everybody wants to go home.
Mm-hmm.
What Horizon does, we have physical therapists, occupational therapists, skilled nursing, and medical social workers and home health aides. So all of those disciplines are available to assist the continuous of care at home.
Okay, so let's say that lady that broke her hip, she also has diabetes, and she's not able to walk yet 100 feet. And she lives, her daughter can come check on her. So what you're saying is that the Horizon Home Health Care Agency has registered nurses who can help her with her diabetes medication, because I'm not sure if I'm supposed to take this one in the morning, that one at night. They gave me shots in the hospital, but I said I don't have to take shots at home. You can communicate with the doctor and make sure they take their medication right. And then they can still get the physical therapy that they started in the hospital or the skilled nursing facility with your physical therapist at home. Is that correct? So, and then what if they're concerned about, and I had this just happen this week, if they're concerned about if they're going to be able to get their medications or not, if their insurance, will the social worker then work with them to make sure their insurance?
The medical social worker does all of that. They may be available for some other supplemental care through Medicare or Medi-Cal. They can help them with Wheels on Meals to make sure that they're properly fed.
Mm-hmm.
Can help them get transit.
So they can get back and from the doctor's office.
Yes, absolutely. All of those services are all part of what they can receive. And what a lot of people don't know is that if you have Medicare, those services cost you nothing. I can't begin to tell you that when we call people and say that the doctor has prescribed these services, they think they have to pay for it. And we say if you have full Medicare, Part A, you can get 60 days worth of coverage at home for free.
And do you take like we talked about just a moment ago, you could have Medicare, you could have Medi-Cal, or you could have the private insurance, so you take different kinds of insurances as well.
That's correct. All of the above.
Okay. Now, the other important thing is, and I'll ask the folks from the skilled nursing side this question, can the doctor from the doctor's office, I have patients that come in, they're on diabetes medicine, high blood pressure medicine, congestive heart failure medicine, and seizure medicine. And I say, now, are you taking all this? Yeah, well, which one do you take? It's there in the book. You got it right there in the book. Well, which one are you taking this one? I don't know. Did you bring your medicine with? I don't know. So can the doctor order a nurse straight from his office to go to the home of the patient and start taking care of them?
Absolutely. Quite often the nurses go out for what we call home meds management to assist and instruct the patient on the proper way to take the medicine. We could set them up, give them a chart, lay it out for them, follow through. So definitely, you can do that without having been in a skilled nursing facility and or a hospital.
So, and that's a little bit different from the skilled nursing point of view. I think they said that you had to be in the hospital 3 days before you could go, 3 nights, excuse me, 3 nights before you can go into a skilled nursing facility. But a doctor could send a nurse directly from his office, fax a referral, and get them to take care of them. Now, and it's covered by most of the insurances.
That's correct.
And also, if a person wants to come from the hospital and go, let's say they're in the hospital only a day, Do they have to, they don't have to be in the hospital 3 days to get your services.
No, they only have to have a hospitalization.
Do they have to choose the nursing agency or the skilled nursing facility that the case manager tells them they have to go to?
Absolutely not. One of the most recent laws just passed is under patients' rights. So the patient has the right to choose which agency that he wants to service them.
So if they know that there are these facilities, if they know there's Willow Tree Nursing and Rehab, or if there's Hayward Convalescent, or if there is Horizon Home Healthcare, they could actually ask and say, that's who I want because I know that the services they provide are the kind of services that I want. I've heard about them. They don't have to use who the case manager says, well, nope, you're going to go to where I send you.
No, they don't have to, but a lot of times the case managers try to push certain agencies.
Okay, so it's very political. We are here on the Healthbeat Show. We are talking about the continuum of care. This will be a series for several weeks. You'll hear from these folks and from other folks talking about what happens to you when you come from the doctors, from your home, and you try to take care of yourself at home. Maybe you go to the doctor's office, maybe you go to emergency, maybe you get admitted to the hospital. Then from the hospital, maybe you go to rehabilitation. Then maybe you go to a skilled nursing facility, and then home with home care. The whole cycle. And it's a little bit confusing, but I hope that we've outlined it a little bit better for you today. And I'd like you to keep watching over the next several weeks as we talk about the continuum of care. We'll eventually also talk about the new health care plan and how it will work for you. I'm Dr. Jeffrey Watson. We've had a wonderful group here today. Miss Glenda Santos, who was with us originally from the TCEC group. She's the regional marketing director of that group for nursing and rehab. Miss Cora Pruitt from the Hayward Convalescent Facility, where they have a dementia unit. And we have Miss Melanie Cox. And we will make sure that you have their phone numbers. You will see them on the screen. You want to tell us your number right away before we get off the air?
Sure. Horizon Home Healthcare, 925-258-9101.
Okay. And Ms. Pruitt?
My phone number directly is 510-755-8700.
Okay. Miss Melanie Cox?
My direct cell phone number is 510-363-5966.
And Miss Glenda Santos from the TCEC group. Can you give us your number where you can be reached?
My direct number is 510-467-2893.
Okay, we are very appreciative to have this dynamic group with us. Keep watching for the next several weeks. We'll be talking about the continuum of care, so you'll know what to do, because I always say that if you knew better, you could do better. I'm Dr. Jeffrey Watson. Remember that your health is your wealth, and when you have your health, you have everything. We'll see you next time.